Hello, my name is Dr. Khaled Alsherbini. I'm the Director of Neurocritical Care and Neuromonitoring at Banner University Hospital in Phoenix. I'm here to highlight the importance of point-of-care EEG when it comes to suspected stroke mimic as part of the stroke code, and especially in this month, May is the Stroke Awareness Month. As we know, the vast majority of these patients presents with non-convulsive seizures, and you really have to have the EEG to diagnose that, and having the ability to diagnose that in the emergency department as part of the stroke code activation is extremely important. That can result in the early diagnosis and early treatment, which is the most important aspect when it comes to management of seizures and status epilepticus. This is a patient who's a 77-year-old female presented with remote past medical history of trauma. She came in with bilateral lower extremity weakness, admitted to be evaluated for Guillain-Barré syndrome. The hospital was a remote hospital with no conventional EEG capabilities, but they did have point-of-care EEG through Ceribell 24/7. And the next day, this patient started having changes in exam. She developed right-sided weakness with neglect and right facial droop with a left gaze deviation. So they activated their stroke code. And then she had the workup done, including imaging, including MRI, which did not reveal any ischemic strokes. And then as part of their protocol, they deviated quickly to the stroke mimics, and the most common one of them was seizures. So they placed her on point-of-care EEG, and during that, you can see in the graph to the right side, there was a sudden rise in the seizure burden graph, which basically suggests status epilepticus with continuous seizure activity. She received 2 doses back-to-back with lorazepam, and that resulted in a drop and resolution of the seizures. She received seizure medication after that, and they continue to monitor her. This is extremely important and highlight the ability of having access to EEGs in a fast and quick manner that can change the patient outcome and result in improvement in the outcome. And for these particular patients, especially as part of the stroke evaluation and ruling out seizures as part of a stroke mimic.